Are you one of the millions who experience persistent pain on the outer part of your elbow, making everyday tasks feel like a challenge? You might be suffering from tennis elbow, a condition that affects not only avid tennis players, but anyone who engages in repetitive arm movements. Medically known as lateral epicondylitis, this common ailment can disrupt your daily life and limit your activities. But don't worry, this guide will equip you with effective remedies and a step-by-step approach to manage and recover from tennis elbow, helping you regain your strength and mobility. Before diving into remedies, it's essential to understand what tennis elbow is. It occurs when the tendons that attach to the outer part of the elbow become inflamed or develop tiny tears due to overuse. Symptoms typically include pain on the outer part of the elbow, weak grip strength, discomfort when lifting or gripping objects, and pain that worsens with activity. The first step in treating tennis elbow is to reduce inflammation and pain. The RICE method, rest, ice, compression, and elevation, is highly effective in the initial stages. Start by resting the affected arm. Avoid activities that exacerbate the pain. This may involve taking a break from sports or repetitive tasks for several days. Next, apply ice packs to the elbow for 15 to 20 minutes at a time, several times a day for the first 2 to 3 days. This helps reduce swelling and numb the pain. Using an elastic bandage or compression wrap around the elbow can help minimize swelling as well. Finally, keep your arm elevated above heart level whenever possible to further assist in reducing swelling. After implementing the RICE method, consider over-the-counter pain relief options. Non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen or naproxen, can help reduce inflammation and alleviate pain. Additionally, topical treatments like creams or gels containing anti-inflammatory ingredients can be applied directly to the affected area for localized relief. Wearing a brace specifically designed for tennis elbow can provide support and relieve stress on the tendons. A forearm brace helps rest the muscles and tendons by redistributing pressure away from the elbow joint. It should be worn during activities that might aggravate your symptoms. Once pain subsides, it's crucial to gradually return to normal activities while incorporating preventive measures. Modify your activities by identifying movements that trigger your symptoms and adjusting them accordingly. For instance, if you play tennis, ensure your technique is correct and your equipment is suitable for your physical condition. It's also important to take breaks. If your job involves repetitive arm movements, take frequent breaks to rest your muscles. Incorporating specific exercises can strengthen the forearm muscles and promote healing once acute pain decreases. One effective exercise is the wrist flexor stretch. To perform this stretch, extend your arm in front of you with your palm facing up. Use your other hand to gently pull back on your fingers and hold for 15 to 30 seconds. Repeat this stretch 3 to 5 times. Another beneficial exercise is the wrist extensor stretch. To do this stretch, extend your arm with your palm facing down. Use your other hand to pull down on the fingers and hold for 15 to 30 seconds. Repeat this stretch 3 to 5 times as well. You can also try ball squeezes by holding a tennis ball or rubber ball in one hand and squeezing it tightly for 5 seconds before releasing it. Aim for 3 sets of 10 repetitions with this exercise. For wrist turn exercises with weight, hold a light weight such as a small dumbbell in one hand while bending your elbow at a right angle. Rotate your wrist from palm up to palm down and perform 3 sets of 10 repetitions. Lastly, towel twists can be effective too. Hold a rolled towel with both hands and twist it as if wringing out water. Alternate directions while repeating several times in each direction. If symptoms persist despite home treatments, consider consulting a healthcare professional for further evaluation and treatment options. A physical therapist can provide tailored exercises and techniques such as ultrasound therapy to enhance recovery. In some cases, corticosteroid injections may be recommended if conservative treatments are ineffective. These injections can provide temporary relief from inflammation and pain. Another option is platelet-rich plasma (PRP) therapy, which involves injecting platelets from your blood into the affected area to promote healing. Surgery is rarely necessary, but may be considered if symptoms do not improve after 6 months of conservative treatment options. Surgical procedures typically involve removing degenerated tissue or repairing damaged tendons through arthroscopy laparoscopic techniques, which are minimally invasive. To prevent recurrence of tennis elbow, it's essential to adopt certain strategies that promote long-term joint health. Always warm up properly before engaging in sports or repetitive activities. This prepares your muscles and tendons for exertion. Additionally, ensure you use proper techniques when playing sports or performing tasks that involve arm movements. Consider working with a coach or trainer if you're unsure about your form. Choosing appropriate equipment is also crucial. For racket sports, select equipment that suits your size and strength while consulting a coach if necessary. Regularly performing strength training exercises targeting forearm muscles will enhance resilience against injury over time. In conclusion, tennis elbow can be a frustrating condition that affects daily activities and quality of life. However, with appropriate initial care, using the RICE method, effective pain management strategies, gradual return to activity with proper exercises, and advanced treatment options when necessary, most individuals can recover fully from this condition. Remember that prevention is key. Take care of your elbows by using proper techniques and strengthening exercises to avoid future issues related to tennis elbow. If you experience persistent symptoms despite following these steps, consult a healthcare professional for personalized advice tailored to your situation. Taking proactive measures will not only help you recover, but also empower you with knowledge about maintaining optimal joint health in the future.